Hi, Kansas City moms. I am here today with Dr. Jade, who is a pediatric pulmonologist at Children's Mercy. And we are here to talk about all things asthma, which I know can be a challenge for families, especially this time of year. So, Dr. Jade, could you just talk about some of the symptoms of asthma and when a family might choose to seek help for their child?
Sure. So asthma classically is described in a couple of different ways. So number one, it has to be chronic, meaning it has to have been occurring for a period of time. It has to be intermittent, meaning the symptoms have to come and go. But the main symptoms that you really see are cough, wheezing, shortness of breath. Sometimes kids can describe like chest pain, chest tightness. On an outwardly, you might hear the cough, but you may or may not hear the wheezing. But oftentimes parents will describe like a cough that doesn't quit. For instance, some parents might say, my kid is great when they're well, and then they're just terrible when they're sick. And then when should you seek help? And that's kind of a good question. So there are a lot of different ways to break down asthmatics. Okay. And I think one way to thinking about it is what we in the medical profession call mortality prone and morbidity prone. And I bring those two categories up to kind of help families understand the different types of asthmatics out there. So mortality prone is pretty clear cut. It's the kids who you see on the television and they're having huge attacks and these are the kids who are in such serious crisis when they have an asthma attack that they require hospitalization, ER visits, the kids who can really black out even or faint on television. And these are the kids that could really have asthma so bad that they could die of it. And that's really easy for parents to recognize, hey, I need to find help for my kid.
Scary, yeah, yeah.
Right, that's serious, right? But then there's this other group of kids that are what we call like morbidity prone. And those are actually harder for parents. These kids might cough all the time, and it's not like a big deal, right? Parents might come and say, he's never had a bad attack. I just don't really think they have that much asthma. So for those kids, I talk about, well, does your child have daytime cough without illness? Okay, just sitting around coughing. Is it happening more than twice a week? Are they waking up in the middle of the night coughing randomly, not sick? Are you finding that they're limiting themselves when they exercise? Is that happening more than twice a week? And if any of those things are happening, then it's really time to talk to your doctor about that.
Okay. So, what are some causes of asthma flares that parents might see?
There's so many triggers out there. The most common ones are colds and allergies, especially in this area. Weather change too. I mean, I was very surprised to when I moved to to Kansas City, how frequently I would have to change my wardrobe.
Yes, even this week. I mean, it's awful.
I know, right? I mean, so
Yeah.
it's like, do I wear a sweater? I wore a light coat, and then by the afternoon, I'm wearing a heavy coat. I mean, what do I do? So the weather change here, especially large swings in temperature of over 20, 30 degrees in a day, can really be very triggering for asthmatics. The other ones, that most people are kind of aware of are like cigarette smoke, strong smells, perfumes, exercise.
Okay.
Yeah.
So obviously we're in a little bit of a respiratory crisis in Kansas City and around the country. And I'm sure that's even scarier for asthma patients. So what, in lieu of the flu and RSV and COVID, what are
Yeah.
you telling your asthma patients to be aware of and how they can protect themselves?
Yeah, I think it has been very stressful for moms and dads of kids who have asthma right now. I mean, we've had a very delightful reprieve with COVID. I mean, asthma admissions, ER visits overall during, our time period where we were quarantining, sheltering in place, cleaning, they really dropped. And then now all of a sudden we just had this big rebound of viral respiratory tract infections. So, the simple things are, wash your hands, cover your mouth, get your vaccines. It sounds really simple and kind of trite, but really that's the things to do. I mean, if you live with someone who you love that has asthma and cannot get their vaccinations, you should get your vaccinations. Okay. So that's really all there is to it right now. I mean, flu is really prevalent in the community. I
Yes.
think last week we had like 1,054 flu swabs that came back positive in 1 week.
Mm-hmm.
So that's just the tip of the iceberg to what we're seeing out in the community.
Right. Okay. Yes, we just got over 3 weeks of the flu in my house.
Yeah, I know.
It's not good. So once a kid has been diagnosed with asthma and maybe has an inhaler, um,
Mhm.
do you have tips for kind of teaching them to use that? And then if they do have to use it at school, what are some tips for using it, storing it, and all the things that come with
Sure,
school usage?
sure. So, number one tip I always tell parents to, when it comes to the inhaler, is really teach your child that the spacer and the inhaler, they are one together. All right. I think, our age, we all grew up watching Steve Urkel do it without a spacer. Okay. Like we were all like, right to the back.
Uh-huh.
Get this. That's not how it works. And I think really just teach your kids, like, if you have this inhaler, you gotta use this spacer. And really remind them that you're going to get more medicine if you use a spacer and if you're doing it with the proper technique. And so in this case, it's repetition, I mean, so I always say the same several steps. Okay. It's shake it, check it, as in check your numbers and make sure you have enough. So shake it real good, check your numbers, put it in the spacer, breathe all your air out, your old air out, put the spacer to your face or mouth, and take in a slow inhale if you're using a mouthpiece. So the other thing I tell parents is the W's, okay? Whistling equals wrong. So sometimes kids love to make the spacer whistle. They think it's super cool. And a lot of the spacers will come with that little ooh noise. And so
Uh-huh.
they
Yeah.
like it. They think they're like, oh yeah, it's cool. I'm making a little goose noise or whatever, right?
Mhm.
No, whistling equals wrong. So if your kid is whistling on their spacer, that's the wrong technique. Um, in regards to transporting, so this one gets a little bit tougher for, I would say my preteen teens. Okay, so your little ones, they're like, usually they go to the school nurse,
Mhm.
right? They're not really carrying around their spacer. Your preteen teens are in a delicate age where they're more conscientious about things. So number one is just thinking of ways, especially your athletes, thinking of ways to carry their spacer around. So I have several cross country track athletes that they have little cute fanny packs kind of things. And I encourage cute little fanny packs where they can carry their spacer and their inhaler. And then I always say, make sure you have a spacer for school and a spacer for home. So ask your doctor if you need those. And I think those are the big ones. And every so often, and this one is tough for kids really to rely on kids to do. So really is you've got to really say, hey, pull out your spacer. Is it expired? And chuck the ones that are expired.
Okay. Are there other things you tell your patients about just being proactive in treating their asthma and kind of protecting themselves?
I'm a big fan of talking about prevention. So, yes, I have a whole list of things that I talk. So, I would say the biggest thing that I work on with my patients, and I think the biggest thing that any parent can work on, is really teach your child to pay attention to their symptoms. And I think this can be really hard because children developmentally, they're not going to sit there and say, oh, what happened first? Did I have the cough? Or, so most kids can be like, oh, yeah, I had a lot of cough, but they don't tell you when or why or what,
Mhm.
So tell them, hey, when is the cough happening? Can you pay attention? When did it happen? Did it happen at school? Was it happening at nighttime? Can they hear themselves wheezing? Do they feel their chest being tight? Sometimes asking them things like, what came first? Was it the cough first? Was it the wheezing first? Those are actually really simple things because teaching them to pay attention to their body, right?
Mhm.
And doing it in a like non-judgmental kind of open dialogue kind of way, like, hey, mommy just wants to know, because then that helps mommy know when to help you, right? And so sometimes kids can even identify what we call our pre-respiratory signs, okay? Like the signs that happen before a cough. Um, and so knowing your pre-respiratory signs are actually really helpful because then you can be proactive as a mom and say, okay, oh, my, so and so told me, hey, mom, I've been feeling a little different today. Or then it's time to pull out the albuterol. It's time to get my meds together. I'm paying attention to what might happen in the coming days. And the that's easiest, I would say, in your school age group, and then working with your adolescent group. The big thing with your adolescent group is when it comes to being proactive is really aligning your interests and their interests, right? So a lot of times my I'm trying to think of the nicest way to say this. My teenagers and my teenager patients and their parents end up in conflict with
Yeah.
one another. Maybe that's a good way of saying it.
Uh-huh.
They end up in conflict with one another
Mhm.
in regards to whether or not they need to do preventative medications, right?
Okay.
Um, and so aligning your interests and saying, hey, these are the reasons to why this needs to happen. Why don't we give this a trial? And then having your teenager set their goals and expectations off of the medications might be really helpful and kind of giving them a sense of control. So I think that's another way to be proactive is because otherwise, if it becomes a nag fight, which
Mhm.
we all know what a nag fight looks like, right?
Yes.
It's like you're like, hey, do this, and then
Right.
every day you're yelling up the stairs, do your Simba card, It just becomes a point of contention between the two of you guys. And it's not, it's not something that should be, it should be something that you can work together on.
Right. Okay.
Right.
So thinking about prevention, are there changes that parents or kids have to make at home? Like changes to their, sports involvement or maybe pets in the home? Do you see
Yeah.
the need
Yeah.
for it?
So that's a really tough one. I personally, when it comes to sports, I feel very strongly that part of the prevention and treatment of asthma also means keeping your body healthy.
Okay.
Okay. So meaning that you have a healthy diet, you are doing healthy exercise, you are staying away from those things that hurt you, okay, or are bad for your lungs, like smoking, vaping, okay? So sometimes those things are not within the child's control, right? So especially like environmental tobacco smoke, environmental vaping smoke, where you live. If you live in an area that there's lots of spraying, crop dusting, you're down the street from, a railroad track, you live on a gravel road. Some of those things parents can't control,
Right.
right? So I talk about trying to do the best that you can to control the things that you can, like the serenity prayer, right? So you do the things that you can, control the things that you can control. Um, and so one thing could be if you live in an environment where you know your air quality is poor, prime example, gravel roads,
Sure.
okay? Live near a highway, live near a railroad track. All those are busy streets. All those are things that increase the amount of pollutants in your air. You can think about something like a HEPA filter for your house, okay? Or maybe even just for your child's room if you don't have the financial resources to invest in a whole filter system for your house.
Right.
Smoking is a big one. Uh, so, trying to minimize the amount of cigarette smoke that's actually in your home. Sometimes I have parents try very hard, and what they do is they say, well, I'm just going to smoke in my room. Well, that doesn't help because the air in your room goes through the main central AC system and just filters all the way through your house, right? Sometimes I've had parents try to minimize tobacco smoke by vaping. And again, it's all well intentioned, but also can be a trigger. So those are things that you can kind of do. When it comes to sports, recognizing that exercise is a trigger for some kids. The things I usually tell parents to do, and I counsel my patients is remember that asthmatic lungs are sensitive and they do not like big changes very quickly. They like to be warmed up and they like to be cooled down. Okay. So we talk a lot about participating in sports that allow that period of time for you to warm up, cool down, and maintain steady activity levels. So maintaining that level of high metabolism. Okay. And those are other things, those are ways to kind of help you when it comes to sports. Other changes, sort of like what I alluded to earlier, having your albuterol with you, having your spacer on your person, making sure that, your coach or your PE teacher is aware that your child has asthma and they're not just wimping out.
Right.
Which is sometimes that, kind of, stereotype that's out there is like, oh, they're just wimping out. No, they can participate in these things. They just need some preparation in order to do so. And then the question about pets is always tough. So pets, I think, can be a trigger. But I think that trigger is mainly if they are truly allergic. Okay. So I never tell a family, just take your dog or cat out of the home. You have to show me that your child's allergic. And I think also that sometimes taking a pet out of the home without a clear indication can be, let's just say, emotionally traumatic. And, so I think you really kind of have to say, hey, I've just noticed that this is really a trigger for you. Before I say, like, I don't do a blanket statement when it comes to that. Have I had families had to take their pets out of their home? Yes. Do I tell them blanketly that I have to? No, I don't.
Okay. So thinking of all of this, it's kind of overwhelming, I'm sure, for your parents' first diagnosis. Can you talk a little bit about an asthma action plan and then how often that plan should be reevaluated?
Sure. So, an asthma action plan at its simplest is a piece of paper.
Okay.
It's just a piece of paper. It's a piece of paper that outlines what medications you should take when you're well, when you're sick, or when you're in crisis mode.
Okay.
At its best, an asthma action plan is an educational tool between you and your doctor or whoever is educating you about asthma. So really, what it means is that it is a physical reminder to you when your child is in crisis. What should I do? right?
Mm-hmm.
And it should really say, when my child is well, I do this. When my child is sick, I do this. And when my child is really bad, I do this. Um, and, if I just hand you a piece of paper, that's not useful. And the data shows that handing somebody a piece of paper that has all the medications on it, not helpful. What's helpful is the discussion and the titration of the medications that are on that piece of paper, right? How do you and when do you implement this plan? Okay. So I almost always encourage an asthma action plan because it allows for that moment of time in your doctor's office where you and your doctor or you and your nurse or whoever is going over it with you can say, hey, do you have any more questions about this? Does this make sense to you? Do you understand what you need to do when your child is sick? Okay.
Mm-hmm.
In regards to when that needs to be titrated. So oftentimes I tell parents that at minimum for the first year of an asthma diagnosis, at minimum, if not the first couple of years, because a lot of times asthma is diagnosed in preschool to school age kids, we need to meet every 3 to 4 months. And
Yep.
the reason why I say that is because, especially in Kansas City, as we've already said, the weather is goofy.
Mm-hmm.
Weather can be a trigger, seasonality can emerge. And in the first couple of years of your child's diagnosis of asthma, you're really trying to figure out, what does my kid need, right?
Right.
And you may not know that, nor may your doctor know that immediately, right? Your doctor may want to say, hey, I'm going to try this first, and I need you to come back and I need you to give me feedback on how we're going to make this better. And so I almost always encourage, somebody to see their asthma doctor at least every 4 months in the beginning. And then as your child's asthma becomes more stable, you can kind of lengthen that period of time out. The guidelines suggest at least quarterly visits because of that reason.
Okay, that makes sense. So kind of wrapping up, what are the signs of an asthma attack that would require getting extra help? I'm sure that's in the action plan.
Mm-hmm.
But what are things that, even people who are around a child that maybe aren't as educated about their
Sure.
pain? What are things we need to be watching out for to help our
Sure.
friends?
So the most commonly used medication for asthma exacerbations, or what we call sometimes asthma flares, okay,
Okay,
is a medication called albuterol.
right.
Right? It comes in an inhaler format, comes in a nebulizer format. So an easy thing to remember is that albuterol should work in 20 minutes and it should last you 4 hours.
Okay.
Okay. If it's not doing those things in the middle of a flare, something's wrong and something's different. So if your child's needing if your child's needing albuterol more often than every 4 hours, that's different, right? Especially if your child rarely ever uses albuterol. Um, so that is one way that I say, a very easy rule to follow. I'm giving my child albuterol every 2 hours,
Mm-hmm.
or at the 2 or 3 hour mark, or, something like that. That's saying, this doesn't make sense. Or if after 20 minutes, my child's not getting relief.
Okay.
Some asthma providers will give a patient the option of what we call a back-to-back. Okay. And that is where you're giving multiple doses of albuterol over 1 hour. And they use that test, almost that back to back, as almost a test to say, if I am giving more albuterol over 1 hour than is expected, and this child is still unable to breathe, unable to maintain a full sentence, coughing significantly, pulling at the neck, retracting, and as in like sucking in at the belly,
Mm-hmm.
belly breathing, obviously turning blue around the lips.
Right.
Right? Those are all problems.
Okay.
Then that means you need to go to the emergency room. Now, some providers want you to really follow the every 4 hour rule and say, if your child's really coughing too much, even at the 4 hour mark, then it's probably time to seek care.
Yeah.
Another more subtle sign of when we say, hey, it's time to call your doctor is, let's say you are in what we call your sick plan or your yellow zone plan in your asthma action plan. If that is happening and you are treating with albuterol and you're doing everything right, okay, and your kid's not in crisis, but just not better, right? I generally give families the rule of 2 weeks. And the reason why I say 2 weeks in the yellow zone is time. If you have been in the yellow zone for more than 2 weeks, then I want you to call me and just send me a message, or say something like, hey, this has just been going on, for a while. And the reason why is because most colds last about 7 to 10 days, right? So even if I expand that to the 2 week mark, that's not just your usual viral cold, right? And it might give your doctor a hint that either one, something else is going on, or two, the medications that I'm providing aren't enough.
Okay.
Mm-hmm.
All right. Well, that was all really helpful and a bit overwhelming, I'm sure, for parents, but it's nice that we have, you to guide parents and their patients through this journey. And we did have you write an article for our website that people can reference as well, and we will link in the comments.
Okay.
We just so much appreciate your expertise. And thank you for sharing with Kansas City Moms.
Thank you for having me. I appreciate it.